Hi there, this is Barbara Dahm. Today I want to speak to you about treatment for people who stutter. This is a really important topic because so many people who have gone to therapy for treating their stuttering or gone to some program, be it therapy or something else, have left feeling disappointed. So I think it's really important for us to explore what goes in to making a program for treating people who stutter, something that will be really beneficial and that people will come away from thinking, this really helped me. So there are 3 ingredients that go into making therapy successful. Those are the person who is facilitating the therapy, the person who is going to get something out of this therapy, and the process that goes on during the therapy. Now, what do you think is the most important of all of these? You might be surprised that I believe, having been a therapist for several decades, that the most important is the process. Now, once you have a process, you do need it to be supported by a facilitator who knows about the process, who has reasons to believe that the process is a good process, and who will do everything in that person's power to make sure that the process goes well. And then we have the person who is receiving the process. The person, I don't like to say receiving because you don't just sit there and receive it. And that's the thing. It is somebody who wants to have something happen, and they have to be willing to make it happen. So if the person goes to a program and is expecting something to just happen to them, they will be very disappointed. So let's look at the possibilities of process. If you are a person who stutters, or a parent or teacher, friend of somebody who stutters, and you really want to advise them, the first thing you have to do is ask them, what do they want? What would make them happy? Now, there are many different aspects to stuttering, we know that. So there are different aspects to what people want from stuttering therapy. Some people just want to feel better about stuttering, and they're not interested in changing their stuttering. They're not interested in speaking in a different way. They just want to do what they've always done, but feel better about it. And that is totally legitimate. Why not? It's not something to be ashamed of, and therapies that help you not to be ashamed of it are therapies that are very beneficial. So that is one aspect of treating people who stutter. But there are other people who are struggling, and they have blocks, they can't say what they want to say, and they're fed up with it. They want to change. They want to reduce the struggle. They want to reduce the blocks. They're not really interested in making deep inner changes, but they do want to have some way of being able to speak more easily, have less blocks, and be able to express themselves better. In recent years, I will say probably the past 40 years, there have been many ways that people have been taught to speak to stutter less. There have been the stuttering modification techniques and the fluency shaping techniques. These have helped many people. There could be things like making a lot of pauses, pausing after every word or 2 words. It could be breathing techniques, which has some effect on your speaking. But the thing with these techniques is that they don't really help completely to be able to speak with ease and comfort. They require a lot of effort. They're not natural. It's not something that people who don't stutter do. And they require quite a bit of concentration, monitoring speech, and this is very difficult. And then there are people who would really like to just get rid of their stuttering. They don't care how. They don't even want to put in much to doing it. They go to a professional who they think is going to help them to get rid of their stuttering. These people are really, I think, missing the boat, because stuttering is a way of speaking and it is something that people do. And nobody can change what another person is doing. You can guide people, but you can't do it for them. There are other people who would like to be able to speak naturally, but they don't want to chase fluency. They don't want to try to be fluent, but they would like to be able to speak easily. They don't want to have to be thinking about stuttering their whole life. Those people are the people who are perfect candidates for the therapy that I give, which is dynamic stuttering therapy, and it helps you to speak naturally. The goal is not to be fluent. The goal is to use your speech mechanism, your brain, your thoughts, in a normal, natural way. But it requires also changing perspective, attitude, your way you react in different situations, and making a lot of deep-rooted changes inside yourself. So this therapy is really only beneficial to people who are ready to persist in making changes within themselves so that speaking can become natural. Let's say that you did choose my way of looking at it, but maybe even this, what I'm going to say, applies to other ways too. Maybe it applies to the some of the fluency shaping or breathing techniques, I don't know. But it's important to realize that whatever you're going to do, therapy isn't just give me a tip or tell me what to do and I'll just do it. I want to kind of compare what therapy is like, the process of therapy, and let's say we have chosen a process that is going to get you what you want. Okay, it has the power to get you what you want. If you've chosen that, we're going to compare it to a gymnast walking on a narrow beam and probably doing tricks as well eventually. But let's start at the beginning, and that's where you have to begin. You have to learn the way to do it, and you do it in a safe environment. You don't go walking on a narrow beam 3 meters above the ground. You start low. You start doing what you need to do to learn how to balance. You need to get your brain used to doing the balancing. This is true in therapy. Speaking is a brain process. So you do need to get your brain used to doing what you need to do to get across your ideas, not across the beam. And this is really very important. People come to me and they start speaking naturally. They have 3 sessions. They start speaking naturally and they say, okay, this is great. They go out and they think it's going to happen to them. But that's not the way it works. That gymnast who was walking on the narrow board does it again and again and again until the brain is used to using that process, until the body reacts the way it needs to react. It's connection between brain and body. And of course, it's also the mindset of the gymnast. And that is so important too with people who want to go through stuttering therapy. You have to have the mindset that says, okay, I trust this process. I might not be doing it exactly like I want to be doing it in the future. I'm learning. I'm going to go back. When I fall off, I go back. When I fall off, I go back. I try to figure out what it is. I take advice from those who understand the process, my coach, and I do it again and again. And that is the beginning. Once that gymnast can go right across the beam very quickly, then they're ready to raise the bar, as they say. So little by little, and this gives you the confidence. When you don't try to get the confidence when you're 3 meters or 5 meters above ground. You build the confidence. You build the confidence by doing. And you have to be doing something that is giving you a way to really go. And that's what I want my clients to do. I want them to really build inside themselves the way. Now, I said that the facilitator has to be doing the right thing. And I have to say that I think that I have been a little negligent sometimes when I'm giving therapy, in that I'm not strong enough and making my clients really understand that they need practice, 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 practice. And I don't mean stopping your work. I don't mean stopping your life and not going to school because you're going to practice. I don't mean spending hours a day, but at least having 20 solid minutes a day of doing the process again and again and again, making sure that you're using the process correctly. And sometimes people come to me for a few sessions, 5 sessions, 6 sessions, and then they know what to do, but afterwards, do they continue to do it? If they do, that would be great. You don't need me for the rest of your life. You don't need the facilitator, but you do need to be willing to do something when you're not under stress. Start when you're not under stress, and gradually use this process in more and more situations as you go on. It's not going to be really beneficial to have had a session where you're speaking naturally for 5 minutes, 10 minutes, 15 minutes, and then say, okay, now I'm going to go to give my presentation, and if it works, that means that this process is good. That is a sure way to have a lack of success. You have to really be doing the process when you're confident, when there's no stakes involved, doing it, knowing what you're doing, and then keep doing it so it gets more a part of you, more a part of you. And then when you raise the beam and go into situations that are threatening, you feel the same confidence because you already know what you're doing. So let's go over what goes into good therapy. First of all, it's a process that will get you where you want to go. Be it just stuttering less, be it feeling more relaxed about stuttering, be it wanting to speak naturally. And then finding a facilitator who understands this process, who is going to help you to do this. It might be a psychologist, it might be some other alternative therapy, that will help you gain confidence, it might be meditation, it could be anything. But find somebody who will guide you to use this process, to be in the process. And then make sure that you are willing to put in, to take it from the beginning, to go through a process of learning, of adjusting, of getting used to, so that your brain, your mind, your body are all synchronized and you're not going into situations where they are threatening and you have to try so hard to get some result. Take it gradually. Get yourself in a position where you know what you're doing and you build your confidence gradually. If people would start looking at therapy in a more beneficial way, I think that the therapies would be more successful for everybody who goes through them. Know what you want. Find a process that's going to help you get there. Find a facilitator who can help you get there and guide you, coach, and be prepared to make changes within yourself. I hope that everybody will gain what they want to make their life better, with or without stuttering.